I'm really excited to announce Karen Hanson, the second recipient of our CWB Wealth Indigenous Health Scholarship. The scholarship has been created in partnership with our client, ARNET, that we've had for over 20 years. ARNET is otherwise known as the Alberta Registered Nurses Education Trust. Karen, I know you're using the scholarship towards getting your nurse practitioner designation. So why is this the career path you've chosen to build on from your nursing career that you already have?
So I see nurse practitioners becoming really well used in communities and up north in the Indigenous communities. They're very well used. Doctors are hard to come by. Now, my past husband was a doctor. I saw him go through residency. I saw him go through medical school. And I decided, at this stage in my life with my daughter and my family, I don't want to do that. But how can I still be up there at that level and still help as much as I can? So I jumped on the NP to do my master's NP, because it still puts me in a position where I'm able to go up north and able to actually be helpful and do things that, me as a nurse right now going there can't do. So I can take it to the next level for them and be responsible for doing things like procedures and prescribing medications and following chronic patients that might need extra, time in with a practitioner, things like that. So that's why I kind of chose the NP side of things.
Karen, what would your advice be for somebody who wants to get into this type of nursing?
If you're going up north, I really want to let people know, you don't go up there with this mentality that you're going to change things. Things will change over time. Things will take time to change, and you have to be a patient person. So you can't go in there and just try to throw things at the community that doesn't know you and ask them to do those things for you and expect that same return. If they don't know you, if they don't respect you, they need time to get to know you before you can start building a schedule with them, building a rapport with them, building relationships with them. You have to have that. It took me a good 2 years to get to that point. But you see some people come in and God love them, they have the best intentions, but they end up getting pushed out because they're too forward about, well, it should be this way and it should be that way and I can make a difference, and it just doesn't work that way. So yeah, my biggest intention was have patients come in quietly, get to know the communities, and then start to build on that.
And if you had one main takeaway from your time you've spent up north working on the reserves, what would it be?
Stop and listen to everybody. Everybody has a story. And it doesn't have to be the reserves either. It can be anywhere, but everyone has a story. So stop and listen to them. Get to know them.